This segment sponsored by GBMC Healthcare.
It's estimated that over 3 million people in the United States suffer from migraines. Brandi got the scoop on what causes them, along with how to ease that pain.
Today we are talking migraines. Nobody likes to get them, but there are some ways that you can treat and prevent them. So joining us now is Dr. Michael Sellman to tell us all about it. How are you?
Fine, Brandi.
All right, so tell me, first, what is a migraine? Like, what makes it different from just a normal headache?
Migraine is one of the most common neurological problems that affects millions of people in the United States. It affects women almost 9 times more often than men.
Really?
Yes, it's a very unpleasant headache, generally throbbing. Light will hurt your eyes, noise will hurt your ears. You want to lie in a dark, quiet room. You don't want anybody to talk to you.
Right.
You just don't feel good. It frequently lasts for several hours, and sometimes you can have associated symptoms of nausea, and if it's really bad, you'll vomit. And people want to just go lie down, lie in bed, just don't talk to me until it's over.
Right, so I guess what are things that people can do to stop them from coming?
Well, that's what you say stop for coming. We have triggers.
Okay.
Things can trigger a headache. There are foods that can trigger a headache.
Okay.
Strong cheese, chocolate,
Great.
beer, red wine, and peanuts can trigger it. Now, it doesn't mean you have to stop all of these, but some people can have an individual sensitivity to food.
Okay.
One of the biggest causes, which is why women get more often than men, is the menstrual cycle. And so you don't have a super lot of control over that.
Right.
Other triggers can include rainstorms, wet weather can trigger a headache. Sometimes people drink too much coffee, tea, or caffeinated beverages. So we try to, in a perfect world, limit the amount of caffeine that your intake is, so that we can actually use caffeine as a treatment for the headache if it occurs.
Right, so that is one of the things, because I do deal with migraines sometimes, and I know that that little bit of caffeine does help it go away, right? But why?
Well, because migraine, one thought for, in layman's terms, why you get a migraine is because you have constriction and dilation of your blood vessels. That means they open and close, and the movement of the blood vessels is painful. And so some of the goals of treatment is to keep the blood vessels from opening and closing and avoiding the movement. And so the caffeine can keep the vessels from opening and closing, and then the pain from the migraine can decrease.
Okay, and a pain with a migraine, I mean, it's just, it feels like it's all over, like you can't even lift your head up. How can you ease that pain?
Well, if immediately, the short-term solution can be to put hot or cold compress on your head. Ice cubes or hot water bottles can frequently be helpful in some people. And then I have a cocktail of, I tell people to drink a strong cup of coffee in combination with Excedrin migraine and toast with some jelly. And I find that can help in many people for occasional migraine headache.
Really? Why the toast and jelly? What is that?
Settles the stomach.
Okay. Okay, and so are there any other kind of tips or treatments that people can do?
Well, for the individual migraine, it's try to stop the cause. But if migraines occur frequently, then there are different types of medication that can be tried. Over-the-counter medication. Some people prefer Tylenol, some people prefer ibuprofen, some people prefer naproxen, and then the physician can get involved giving prescription strength medication. I can't emphasize enough for getting enough sleep. Lack of sleep is a frequent cause of a migraine. Not getting enough exercise, or the reverse is plenty of exercise, aerobic exercise where your heart gets pumping, can help to reduce the chances of a migraine headache, and avoiding stress. Those are just general hygiene measures in life. and also avoiding alcohol. Alcohol is a frequent potent trigger of headache.
Well, thank you so much for being here with us today, and hopefully those tips can help some of those migraine sufferers out there. I know I'm definitely going to try that toast and jelly. Thank you.
You're welcome.